bleeding is an excessive amount of blood loss. It may be caused by anything that cuts or damages of a blood vessel. Even a small injury can result in a severe external bleeding. To treat someone with a severe bleeding, first, you need to put gloves. It will help you to protect you both from infection. Second, if the wound is covered by clothing, remove or cut the clothes to uncover the wound. Third, if there is an object, don't pull it out because it may be acting as a plug to reduce the bleeding. Instead, leave it and apply pressure on the other side of it to push the edges together. Fourth, if there is no object in the wound, apply direct pressure on the wound with your fingers and use a sterilized dressing or a non-fluffy pad to stop the bleeding. Fifth, if you don't have a dressing, ask the casualty to apply direct pressure on themselves to stop the bleeding. And sixth, ask the helper to call 911 for emergency help. And seven, the casualty may be develop shock, so help them to lie down on a blanket or a rug if there is one to protect them from the cold. And number 8, raise and support your legs so they are above the level of their heart. Do not raise the leg if it is injured. And next, number 9, secure the dressing with a bandage that is firm enough to maintain the pressure but doesn't cut it off the circulation. And 10, check the circulation by pressing the nail bed or skin beyond the bandage for 5 seconds. Release the pressure. If the color does not return within 2 seconds, the bandage is too tight. And next, number 11, if the blood shows through the dressing, do not remove it. Just apply a second bandage on the top. And number 12, if the blood shows through the both dressing, remove them and apply fresh band-aid, ensuring there is a direct pressure applied at the point of the bleeding. And number 13, support the injured part with a sling or bandage but check every 10 minutes. Number 14, keep monitoring the casualty's level of response while waiting for the help to arrive. So remember, when treating someone who has severe bleeding, first, wear gloves if it is available. Second, remove any clothing around the wound. Third, check of any objects in the wound. And fourth, don't remove them and apply pressure either side of the wound. If there is no object, fifth, use for a dressing or pad and apply direct pressure to the wound. And sixth, call 911 for emergency help. And 7, secure the dressing. And 8, treat for shock. And 9, support the injured area. And lastly, monitor the level of response.